Aortic valve stenosis prevention. You can't always stop aortic valve stenosis from happening. For instance, there's nothing you can do about a heart defect you were born with. But high blood pressure, high cholesterol, and obesity are linked to aortic valve stenosis, and those are issues you have some control over. Your doctor can advise you on ways to manage all of these conditions. Good dental hygiene also helps. Serious gum disease may be linked to heart inflammation. And if you ever have strep throat, be sure to treat it with a full round of antibiotics to prevent it from becoming rheumatic fever. If you get rheumatic fever, it can also be treated with antibiotics. The better you can manage some of these issues and the earlier you act on your symptoms, the lower are your chances of developing valve problems. Tips for living with aortic valve stenosis. In addition to your doctor's treatment plan, you can take steps to keep your heart as healthy as you can. The goal is to manage the condition well. Attend all your planned doctor visits. How often you check in with your doctor will depend on the symptoms you have and how advanced your condition is. If it's moderate or severe, you may need to see your cardiologist twice a year. If it's mild, you may need only a yearly exam and an echocardiogram every 1 or 2 years. Take your meds. Follow your doctor's orders and take any drugs exactly as prescribed. These medicines can help keep your heart from working too hard and prevent blood clots and infections. Stay active, but be safe. Working out is good for your heart, even if you have aortic stenosis. First, check with your doctor about whether there are any physical activities you should avoid. You'll also want to know how long your heart rate can safely be raised and whether you need to track how high it gets during the workout. Ask questions. Notice new or changing symptoms? Don't ignore them. Call your doctor and discuss any concerns you have. Care for your teeth and gums. Aortic stenosis raises your risk for infective endocarditis, a severe infection of the heart lining and valves. It's caused by bacteria that get into your bloodstream, often through your gums. To prevent this, brush your teeth twice each day and get regular cleanings. Let your dentist know that you have aortic stenosis. Don't put off surgery. Your doctor may advise a procedure to repair or replace your damaged valve. This may sound daunting, but most people find that their symptoms improve afterward. Without treatment, your chance of heart failure will rise. Get support. If a heart condition makes you feel anxious or depressed, talking about these concerns may make you feel better. Confide in loved ones, or ask your doctor to refer you to a counselor. Get to a healthy weight. Being overweight or obese puts strain on your heart, especially if most of your fat is around your waist. Writing down the foods you eat and when you exercise, or entering this info into an app, can help you spot unhealthy patterns. Manage your stress. Everyone feels anger, sadness, and anxiety from time to time. But if these feelings are out of control, it can take a toll on your emotional and physical health. Find healthy ways to relax, such as exercise, meditation or prayer, spending time with loved ones, and laughing more. Talking with a counselor can also help. Watch what you eat. Aim for a diet that's rich in whole grains, lean protein, fruits, and vegetables. Eating more meals at home will help you build better eating habits. When you can, avoid highly processed foods. Many products that come in a bag or box tend to have sodium, sugar, and unhealthy fats. Manage other health conditions. If you also have diabetes and/or other types of heart disease, make it a priority to take care of those conditions. Cut down on drinking. Alcohol can raise the level of some fats in your blood. It can also boost your blood pressure and add strain to your heart. Limit yourself to no more than 1 or 2 glasses of beer or wine a day, depending on your size. Quit smoking. The chemicals in tobacco smoke harm your blood vessels and keep your heart from working as well as it should. Talk to your doctor about ways you can break this habit. Many hospitals and local community groups offer free classes or support groups that can help.